We're hearing from one family impacted by the lack of Medicaid expansion. Our Capitol Bureau reporter Rebecca Chung spoke with them this week. She joins us live at the State House now. So Rebecca, this has been going on for years now amongst lawmakers. So where do things stand now?
Well, Brooke, it's an issue that comes up almost every year here at the State House, and it could come up again this year. But in the meantime, we have families like the one I spoke with struggling to find affordable care.
We had purple tomatoes, basil tomatoes.
Louise Lynch and her family live in Kansas City. Her and her daughter spend hours tending to their garden and giving back to those in need.
Over the summer, we've been able to sustain ourselves on it and give produce away to people who are hungry.
But they say trying to find affordable health insurance hasn't been as rewarding.
It's like going into a sandwich shop, being hungry, looking for the cheapest thing on the menu. But even the cheapest thing on the menu is too much for your pocket.
Louise and her husband both have health insurance, but their daughter, Sara, does not. She's been trying to find coverage for the past 3 years after no longer being able to stay on her parents' insurance at the age of 26. She suffers from a series of health conditions like asthma and joint pain, but she says it really went downhill when she caught coronavirus last year.
She was put in an ICU for a while. She had about 4 different hospital admissions.
Sara was on track to become an attorney at the time, just wrapping up law school. But she says her life took a turn for the worse, now suffering from many of the symptoms she experienced when she had the virus. On top of that, Sara was seeing doctors for a suspected autoimmune disorder. But when her insurance was gone, she wasn't able to get further testing for a diagnosis.
I have eye issues. I have some brain damage. I see multiple specialists at KU Med, and I've been blessed to be able to get 3 months of charity care from them. But when that ends, I don't know what I'm going to do.
Sara's mother tried researching insurance options but found nothing. She says her daughter doesn't qualify for Medicaid because of Kansas's strict eligibility requirements.
I refuse to let her go down that track, that she's nothing, and be what these people, quote unquote, categorize her in.
Well, right now there are lawmakers here that argue that expanding Medicaid would lead to steep financial costs that would then trickle down to low-income Kansans. But of course, Sara and her mother say that expanding coverage would allow them to get the care that they need, as well as other Kansans that are struggling to get by. Live at the Capitol covering local news that matters, Rebecca Chung, KSNT News.
All right, thank you, Rebecca.